Hey, this is Phyllis. I've had a lot of requests, people asking about how my in-office carpal tunnel surgery went on Friday. So I wanted to put out this quick video to kind of let everybody know my experience. I had the in-office carpal tunnel surgery done on my right hand. And to be honest with you, I really wasn't that crazy about having the in-office procedure. One reason, because it was extremely painful when they had to numb the area. When you're put to sleep, they don't use needles to do any type of numbing. They just put you to sleep. But I was stuck, here in the wrist with needles on two different sides. That was extremely painful. Plus right here in the tender part, this lower part of the palm, which is also extremely tender. So being stuck there, with needles, that hurts. And I'm a pretty tough lady, and I can, deal with pain. But like I said, this was kind of tough. Plus, when the doctor was doing the surgery, the pulling the skin away and doing the clips and stuff, I could feel all that pulling and pushing and prodding around in my hand, and that wasn't very comfortable either. One thing I thought, you should always ask questions about, where your incision marks are going to be. How long are your incision marks? Because I just assumed when the doctor said it was going to be done in office, just numbing it up there without putting me to sleep, the new way of doing it. I assumed that when he was talking about the new way of doing things, I thought he meant by doing it the new way, which truly is a new way of using an ultrasound, where they go into the wrist, and they make like a little 1 millimeter or to 2 millimeter incision into the wrist, and then a very, very small tube that's got a little type of knife. They can go in there, and under the ultrasound, they watch where it's being guided up into the nerve area, and they clip and to free up that nerve that's being choked. And then there's no stitches. They end up putting a bandage on your wrist, and you keep it there, the bandage there, for I think 72 hours. And recovery is pretty much 3 to 6 days, and you can go back to your normal activities, and you're very, very limited, just a few days. Like I said, 3 to 6 days, and maybe a few weeks after that. But unfortunately, my recovery is going to be 4 to 6 weeks, because there is a 2-inch incision, not a millimeter, type incision, a 2-inch incision from the palm that crosses over into the wrist. And like I said, that's going to restrict me for 4 to 6 weeks on lifting, pulling. I'm not supposed to even play on a computer with this hand for 2 weeks. And then after the 2-week period, once they take all these stitches out, then I'm going to be having to do some type of physical therapy to regain my motion and my strength. I wasn't particularly crazy about that. I did have carpal tunnel surgery years ago, where a little 1-inch incision, this was done with another surgeon, was done in just the palm of the hand, and my range of motion, everything was good. That recovery time was super quick. I had to have no physical therapy or anything. So like I said, I was extremely shocked when I read on my paper all the restrictions for this in-office procedure with the long incision, about this long recovery time, having to do physical therapy to regain my strength, my range of motion and things. And I'm just I really like the surgeon. I don't blame him. It's the company that he works for. He doesn't work for a private office, like or private, doctor's office, or work for himself. He works for a company in Greensboro. So most of you, may have been to this particular company. I don't want to give any names out. For knee problems, foot problems, or shoulder problems, you might have, or neck problems, you could have, seen different individuals within this company over in Greensboro. And like I said, I really like the surgeon. He's young, and he's very caring. But like I said, it's not his fault. this type of surgery is normally done in the operating room, and normally you're put to sleep, but because of the insurance is getting where they don't want to pay, for medicines or procedures, you're very fortunate now to be able to have any type of, surgery. They always want to, just give you a bunch of pills to take, or you're on your own, just dealing with the pain. But anyway, I'm not having any pain, thank God. I'm just taking a Tylenol because I definitely didn't want to get mixed up with any type of opioids or anything, because they do cause problems. After 3 or 4 days, you really run that risk of your body becoming addicted to the opioids. And I did have that problem when I had shingles back in April. I just took one hydrocodone a day, just one. It was 7.5 milligrams, just enough to take the edge off the shingle pain, because I had shingles from the center of my chest all the way across here, under my underarm, and all the way around to my back, and it was very, very painful. And I did just the one hydrocodone a day, like I said, the 7.5 milligrams, and my body became addicted to that small amount in a very quick, amount of time, anything over 7 days. That when you're involved with these opioids. So I definitely didn't want to be involved with opioids again, because it was a pain in the butt, and pretty frustrating having to taper off opioids once you want to quit cold turkey, and your body's not going to let you. Your doctor has to put you on this taper schedule, and you have to take it every day, and the tapering schedule runs about 6 weeks, and it's very frustrating. So I am putting up with a lot of pain, and like I said, just taking the Tylenol, for the swelling and the pain, and because like I said, I don't want to get mixed up with opioids. Even though the doctor did give me a prescription, I think for Tramadol, I wouldn't dare take it. But anyway, I just wanted to, like I said, different ones have asked me, how the in-office surgery went on the carpal tunnel. Would I recommend it? No, I wouldn't. If it's not going to be under the guided ultrasound, where it's just a very, very little tiny incision in the wrist with 3 to 6 day recovery, no, I wouldn't recommend somebody doing this in the office. You really need to be put to sleep, because it is uncomfortable, scary, and like I said, with the incision I had made, I've got a 4 to 6 week recovery time. I'm not really crazy about that. And like I said, if I'd have had my choice and would have known, I would have just asked to have gone through like the hand center and been put to sleep. So that's just me personally. Like I said, I'm very tolerant and pretty tough to pain. But like I said, get jabbed in the wrist with needles, that really hurt, and the pulling his skin apart so he could see, and kind of the cutting and messing around with the wrist. Like I said, it was just pretty nerve-wracking, and like I said, it was very uncomfortable. So no, I wouldn't. I would definitely, seek out somebody that could actually do the ultrasound guided procedure, which is the newest type of in-office procedure. But no, not the old way. Mine was done the old way. The only difference was I wasn't put to sleep. It was just done in the office, shooting needles in there, numbing it up. So I wouldn't recommend it. I know a lot of people have had this done, but like I said, I wouldn't recommend it, to anybody. I think the being put to sleep in this circumstance, this particular circumstance, would have been, best. So I hope this video has been helpful to you. And if you have any questions, feel free to inbox me. Take care, and God bless.